Hi, I'm Dr. Tom. I'm with Cosenta Wellness and Cancer Care Center. And today is part of our Cancer Mythbuster series. And today's Mythbuster is that IPT for cancer treatment always works. And so for those of you that may not know what IPT is IPT stands for Insulin Potentiation Therapy. And basically, the idea behind it is that you give a patient insulin, it lowers their blood sugar to a very low level, and then at a certain point, you introduce chemotherapy with a little bit of glucose and a little bit of insulin, and you drive use insulin to sort of drive the glucose and the chemotherapeutic agents into the cancer cells. Reason why I'm discussing that today is I get a lot of calls from patients that are looking to come to our center, and they'll say, "Hey, do you guys do IPT?" And I always ask them, "We could do it, but what makes you think it's what you need?" It seems like a basic question to ask, and I'm surprised that a lot of these people don't ask that of themselves. Like, if you're going to see a doctor of any kind and a doctor recommends a treatment, one of the questions should be "Hey doctor, please explain to me how this treatment will benefit me and fight the cancer cells in my body." And so what I want to do is just show you real simple, like, how would you know if you would benefit from IPT? Well, first you need to know, what kind of receptors do your cancer cells have? We now know that first, the data on IPT is really, really mixed. So first, I got a web page pulled up here. This is from 2015, and this is when Dr. Forsyth had published in an alternative medical journal that he has success with integrative cancer therapy using chemosensitivity testing and insulin potentiation therapy. I don't really know what his outcomes are. I do know we've had a lot of patients that have gone there and still have cancer, and they contact us. So I don't know numbers. I just know that it's certainly not 100%. And so when I look at then, okay, well, what are they doing? What are other doctors doing that claim they're doing IPT? First, I look at, well, what does insulin do to a cancer cell? That's something basic that should be of concern that anyone's going to do it. And first thing that comes up is there's all kinds of questions on, can insulin be a useful tool? And so here's a paper in The Lancet that sort of criticizes the use of insulin for treating cancer because many cancer cells get stimulated by insulin. And so now kind of think of it, one of the concerns is that, hey, on the one hand, you have all these guys in the alternative medical space saying, hey, sugar feeds cancer. One of the things that carbohydrates do is it stimulates insulin. And so, of course, you don't really know, like when someone eats a high glycemic meal, and let's say if their cancer grows, was it the carbohydrates directly or the insulin? Because there's not any type of real-time analytics that shows you what molecule is going into a cancer cell in vivo, like inside of a human. So there's like a lot of guessing really that happens. But if you look at now saying, okay, like, is insulin a good or a bad guy? Well, as you go through the literature, a couple of things pop up. First thing is you see, this is a paper, this goes back to 2020, and says rethinking the relationship between insulin and cancer. And kind of basically what it says is it's not always the same, right? So think of it this way. What if the cancer in your body has a high number of receptors for insulin? And there's sometimes you might see that as insulin receptor substrate or an IRS or something like that. And the concern about that is that if there's excess insulin, that excess insulin can actually stimulate growth and spreading of the cancer. So in those examples, or for those conditions, insulin may not be a good tool because it may actually stimulate the cancer more than the chemotherapeutic agent going into the cancer cell can damage it. So there's kind of that concern. And now there's another concern that I came across recently. And one is that some people have a germline variant. So that means that they were born with a mutation, and that given that mutation, that they could have some serious side effects from different therapies. And so basically, here's a paper that talks about germline genetic variants associated with the development of insulin-dependent diabetes in cancer patients treated with immune checkpoint inhibitors. So basically, the summary is this. So the patients with cancer get treated with a therapy called an immune checkpoint inhibitor. And that therapy results in that patient developing diabetes. Now, why am I sharing this with you? Well, one, because what I wanted you to be aware of is that sometimes people do a therapy that may appear on paper to work, but because of missing information about the individual, you don't see that when you introduce that therapy, something that you were born with is now going to be used against you and create further damage. So cycling back to IPT, before any patient should jump all in and do the therapy, they should first have a better understanding, like, is insulin, could it be a driver for their cancer? And you can get that if you look at some of our other videos. We talk about, well, different ways you could look at the genes that are driving the cancer. Is there potentially a germline mutation that you were born with where the therapy itself may create another problem? And so if you don't know these things, why would you just jump all in and doing a therapy that has a lot of potential unknown harm in some cases without understanding? So now, on the other hand, let's say you had a cancer that there's no obvious, insulin driver for it, and you don't have any germline genetic mutations that appear to be receptive to in a negative way to that therapy, then it might make sense to give it a shot or try. What you could do let's say if you don't have access to that testing based on, where you are, what you could do then is say, okay, I'm going to do some molecular and cellular measurements that within 2 weeks, I'll see what's happening with my body's response, or the cancer's response, rather, to the therapy. And if you look at some of our other videos, we discussed those concepts, like how do you know if what you're doing is working? And so what I want patients to get out of this video is that it's never a good idea to jump all in on a treatment without first knowing details about your body or the cancer in your body in some cases that may make it so the treatment is going to create more problems than it's going to solve. So if you or your loved one have cancer and you really want the best possible outcomes for that person, I strongly suggest you fill out the form and contact us at Causenta and let us show you why we got really good outcomes, because we pay a lot of attention to details that most places don't even know that this information exists. Thank you.